on.
Hello, everyone out there in the social media village. My name is Tomás, and I'm going to be helping to facilitate a very important conversation today in regards to the current state of the pandemic and COVID. This is the FPHYA Hub, the Flint Public Health Academy Hub, working for the Michigan American Public Association. So I have some wonderful co-hosts and guests today that are going to give you a dose of that knowledge. So we're going to kick it off with Everett beginning the first questions of our dialogue.
Hello, everybody. Like he said, my name is Everett. I'll be helping him facilitate today, and we can jump right into it. Our first question is, why is it important to get vaccinated, especially for the youth? And we don't really have an order here, so if anybody want to jump in, just go ahead.
Okay, so I have a few thoughts on that. So I'm a second year medical student, so I just actually turned 25, so I'm not like a teenager, but I'm still, like a young adult. But I'm vaccinated, and just basically, kind of what I've learned and what I've experienced is really important for people to get vaccinated because it lowers your risk of getting the virus, number one, and also preventing just serious illness, because there are a lot of long-term complications that come from getting infected with COVID. I'm sure you guys have heard of people losing their taste and smell, and those are just some of the mild, scenarios. But COVID actually can affect all of your organs. So it can affect your brain, your kidneys, your lungs, your heart. And so especially as, young people, you definitely don't want to be getting an illness that is preventable, by getting vaccinated. So just kind of as a brief explanation, that's kind of my 2 cents. And also, in addition to protecting yourself, you also want to protect others. There's a lot of people who are immunocompromised. They have illnesses that make it harder for them to fight off a cold or, COVID-19. So I'm just thinking of them, kind of being, altruistic. You definitely want to consider getting vaccinated to protect your loved ones and other people out there as well that may not be able to fight it off as well as, maybe you can.
Yep, and that's a huge point. At least when getting vaccinated for me, that was one of the things I really thought about was, no one really knows like the long-term effects of COVID because we're all living in it in this moment. So when a vaccine was presented, it was kind of just like, if I don't take it, although, I was weary, if I don't take it, who knows what could be, the effects of not taking it versus, the effects of taking it. Does anyone else have anything to add?
I'll also jump in. I definitely want to echo what both Alexis and Everett are saying. Because it's really, like, first of all, it's better to get the vaccine than to deal with the real live virus of COVID-19. And yeah, speaking to that point on like long COVID, like one important limitation of science and this scientific research is that we can't predict what's going to happen in the future. We have not seen this. And so we know, many people, children, adults, people across across the lifespan are contracting COVID. But with youth specifically, like you're still growing, and it's especially your brain. Like I'm a brain person, and your brain is still, developing into your 20s. I just passed the stage. So I'm a few years older than Alexis. I'm 28. I just passed that stage of, adolescence where my brain finally is like, okay, cool, we're done. But when you're dealing with COVID, like we don't know what that could do, because we know that it can cause some, neurological issues in the short term. People talk about brain fog and stuff like that. So there's no telling, what we'll see down the line. And we won't know, are there differences in how people show up with long COVID, based on how young they were at the first time they got an infection, the number of, times they got additional infections, and other factors. So it's super important for us to get vaccinated. I'm like, next time they put out a booster, I'm getting the next one too. And then the final reason, well, one of many, but my final reason that I think we should get it vaccinated, especially as youth, is getting to kind of a new, better normal. So by getting vaccinated, we're able to engage a little bit more freely, whether it's in school or in our personal lives. We have fewer disruptions to our attendance at school because if you're vaccinated, you might have a shorter wait time, especially if you don't actually contract the virus. You can go right back to school after you have that test. And then there's fewer incidents truly of grief because as young people, we oftentimes are the asymptomatic carriers. But I think Alexis mentioned we have loved ones who are high risk. And so when we continue to prolong this pandemic, that means we're dealing with, we're prolonging that grief. And just today, I think it was today or yesterday, we hit that 1 million COVID death mark in the United States. And it's we're still doing this. We have these wonderful vaccines, and we still, are dealing with this. So, it's important for our mental health to get vaccinated, to get this over with.
Yeah, definitely. I definitely agree with that. And also, I just want to add another point. A lot of people make the argument that, well, I've had COVID before, so why do I need vaccinated? And so there is some truth to that. When you do get infected with the virus, you do have some natural immunity, you do have some antibodies. However, that only lasts for a certain period of time. And I believe scientists and the researchers have kind of studied and came to the conclusion that it's roughly about 6 months. So after you get COVID, roughly have about 5 to 6 months of natural immunity, but after that, it pretty much wears off. So even if you've had COVID, it's still really important for you to get vaccinated so that you can have the most amount of protection against reinfection or serious illness if you do get infected again. And I also wanted to make the point that even people who get COVID and are asymptomatic still show signs of some of those long-term complications that I mentioned earlier. So, there are people, for example, who are asymptomatic, but were in studies that examined their lungs and stuff, and they still showed their lungs still showed damage from the COVID-19 virus, even though they were asymptomatic and seemingly fine. So, even if you get COVID and you don't really get sick from it, you could still have some long-term complications that, to your lungs, to your heart, whatever the organ system is. So definitely getting vaccinated and some side effects you might have from getting vaccinated, headache, fever, whatever the side effects have, that definitely outweighs the risk of, getting COVID and having to deal with those long-term complications that really could severely affect your health. So I just wanted to make that point as well.
Yeah, that's an extremely valid point. Just hearing you, Alexis and Jasmine, talk about it, it kind of just made me think of this. With COVID lasting so long, there's a lot of doubt, and a lot of people are starting to kind of, not take it as serious. At least in what I've seen, I feel like we've been in this, 3 years-ish, and we're kind of getting to a point where people are acting like, either it doesn't exist, or they're like, well, I've lasted, 3 years, haven't gotten the virus yet. Why do I need to be vaccinated? That's stuff that I'm hearing from people, or people have I've had COVID, twice now. I haven't, been put in the hospital yet. So what is the point of me getting vaccinated? And it just goes to show that a lot of people still don't understand what truly is going on here. When we're talking about the long term, it makes me think of the different variants of COVID. We've had, mild variants, we have very aggressive variants. So me thinking, hey, I'm gonna get this vaccine, it'll protect me from the original thing, and then also help me out towards whatever may spiral based on, other people not getting the vaccine. So with that being said, does anyone else have anything to add to this first question? Alrighty, hearing none, we're gonna move on to the second one. Cases are dropping and rules are less enforced. Is the virus gone?
Absolutely not. So, just this week, as I was saying, we kind of hit that 1 million COVID deaths in the United States. And just yesterday, there were 1,355 people who were a part of that number. 47,000 new cases across the United States. And when you look at this time last year, so this year, we had 1,355 COVID deaths yesterday. Last year on March 23rd, we had 893. So, and that was without a vaccine. And we had 54,000 cases last year. This year we had 47,000 cases, on the same day. And it's like, we're dropping we're dropping our masks, literally, we're dropping our, rules. And those layers of protection matter. It's like, you have to have the vaccine, you have to have the mask, you need to social distance as well. Like, once we let up, that's how these variants kind of take hold and really, get footing. And, we see these spikes. Like right now, I would say we're doing decent, but right now is not the time to say, oh, whatever, and I kind of worry, like, we'll think it's gone as the weather is getting warmer and stuff, and we'll forget about the strategies that got us to this place in the first place. Like, if you're going to be inside with people that you don't live with, put a mask on. Like, if you're outside and, enjoying your summer, cool, do you, while the cases are low. But if you're going inside, just, a little quick thing, and it's not a huge, undertaking, but it could really save somebody's lives. So no, COVID is not gone. I'll leave it there.
Yeah, Jasmine, you pointed out some great points in that. Obviously the virus is on, like you said, we're losing people every day to this thing. But it seems like a lot of people's sort of general outlook on it is that it is gone. And it kind of sucks to see that, just because, what can you say to somebody like that? At least me, myself, I'm like, I can say, it's not gone, check out these facts. But to some people, that's just not enough. Is there anyone else who would like to add?
And I'll just say, like, when you say, to people, there's so many of us, like, I'm a whole, public health scientist who studies epidemics, and I'm over it. Like, I'm ready for this to be done. And the way to kind of wrap this pandemic up, and I know we'll kind of get to it, but that way is by implementing the public health strategies that we know work. Like, when it's like, I'm so frustrated, that's what keeps me putting my mask on every time I go into every time I go around family members who are high risk, every time I'm inside of a building where I'm with people I don't live with, and I only live with my dog. So when I'm around people, I don't live with, I'm putting on a mask. And it's not to say, like, 100% of the time you have to be 100% perfect. But if most of the time you're doing what you need to do, that's how we collectively, move this forward.
Yeah, and I feel like that's what it really is about. I feel like if everyone puts their best foot forward, then we'll start heading back in the right direction. Like you said, looking at the numbers compared to, the same day, just a year prior, there's not much difference in those. And it's kind of like scary, especially because, we've gotten worse. And it could be to do to whatever circumstance, but the facts still remain that, like, we're not taking it as serious as we once were, and we're allowing like certain members of our society are allowing themselves to kind of slip back into that mindset of, oh, it's okay, we'll be fine, we don't need the vaccine, we don't need to wear masks, like, everything will just go back to normal. And that's just not, sadly, that's just not how it's going to happen. I wish we could just think it away and tomorrow we can wake up and be done with it, but it's become like yeah, like, it's become like a kind of a staple. Thinking about it, like, there is kind of funny to think about, like, there's kids who have been born in these past 3 years who all they've known their lives is, my mom always has a mask on when we go to the store. I don't really know why yet, but that's something I'm used to. We don't hang out, in big groups of people anymore. Like, we don't go to the mall and, just sit around standing. Like, there's certain, things that have become normal in life, but there are still a lot of people who aren't acknowledging these things to be true or be necessary. Does anybody else want to add to this question? If not, I'm going to pass it to Cole and we can move on.
All right. Wait.
I think you're good, Cole.
All right. Thank you, Tomás. So we already dipped into why it's best to get vaccinated, as well as some bits down to why it's a great idea to wear a mask. So why is it important to follow COVID procedures in schools?
I'll speak to this one from a high school standpoint. Um, Other than the obvious, we want our youth to be healthy. They're the future of our society, so we want them to be happy, healthy, things like that. It also takes away from an education standpoint. It also takes away from that. I have a lot of friends who are still recovering from the original time where we went out of school because of COVID, where they kind of just dropped everything. It was like, we'll pick it up, next year. I still have a lot of people who are recovering from that, as well as being online school. Like there's a lot of things that come with being online school after being in person your whole life, and just, one day having to switch and be online, learning completely different. There are a lot of like negatives that come with that. My grades dropped. I have a lot of friends who are like, at the verge of like failing, or like, have lower GPAs now because they were struggling in those times. So for me, when I think about why it's important to, take care of yourself, wear your mask in school, social distance, because if we don't, we're going to be back in that situation where we're not going to be allowed to come to school. We're going to have to be at home. We're going to have to do online school, and just watching the different effects that has had on people, whether it's their grades, their mental state, how social they are. There was a time during us quarantining that I could go a week without, speaking to another person that I don't live with. I wasn't, making the effort to reach out and, send a text, send a call to anybody. I was just, isolated, in my own house. So just the various effects that, not taking care of ourselves can lead to, I just don't want to see that for us. So I think it's really important that we follow these guidelines and, prioritize them to make sure that we can stay in our school buildings.
Yeah, excuse me. I definitely agree with you. That was a really good point. For me, I'm in medical school, and I'm actually taking some time off right now. So I finished my first and my second year, but going into my third year was like, going through med school during a pandemic and being online, it really took a toll, on my mental health. And so just the anxiety and just the difficulty of having to learn online. I also saw kind of some changes in my grades as well. I had to work a lot harder to try and, maintain the same type of grades that I was getting. And so I can't even imagine what like elementary school kids or middle schoolers or high schoolers are going through, because, you're younger. And so, you might not have access to as many things. And so, I'm sorry. Thought. But yes, anyway, so it's very important to keep following the COVID-19 procedure, in schools, wearing your mask, and social distancing as much as possible, because the more we do that, the sooner we can kind of come back to a sense of normalcy, and and we can be in person for classes, and being around our friends and stuff like that, so that we can have that social support and just overall better mental health.
So important. And yeah, just to build on what everyone's saying, like there are so many factors to consider when we think about, following COVID procedures in schools. Like think about your own life, like first and foremost, like your own life. And I'm not presently a student. But if I were in this situation, in the kind of conversations I have with my nieces and nephews, like you go into that school building with your mask on because that's your life. Like your life is valuable. Your life is worth something. You want to stay healthy. You want to be as healthy as possible, as it's in your control. And then two, like when you're out there, you're representing your family, and you're connected to your family. If you're not following protocol and things like that, then you come back into your household and 50 other students go back into their household. Now we have an outbreak. So, your teachers, like cafeteria workers, other staff members, your friends, like as a community, it's all connected. And then at the same time, with this question, like, why is it important to follow COVID procedures in schools? So I will say, like, if your COVID school rules are more relaxed than what you've been doing, follow the strongest guidance, you know what I'm saying? Like until you hear like from like a person like Dr. Key or like a, Dr. Fauci, like until you hear that this pandemic is like over, no chance of it popping back up, keep doing what you know to do. Keep wearing your mask, keep, keeping your distance, staying up to date with your boosters and all that. Like we saw, as parents were protesting masks, some students decided to keep theirs on. And that's huge. So it may be helpful to like, not think of them so much as like restrictions, but like opportunities for you to step up and help your community by doing this little tiny thing, like you're playing a huge role. So it's important to follow the COVID procedures in the schools. And then if they're too lax, go with what you know. You know what I'm saying?
Just to briefly piggyback off what Jasmine was saying, like a lot of people just and think, oh, it's not really anything. It's just a small, like the cold. But as Alexis and everyone else was describing earlier, like you can, like me, I had it and I lost my sense of taste and smell. And that was the worst thing. Cause me, I'm Mexican. I love to eat. I love every little season, crunch, grease, everything. And just not being able to have that ability anymore was devastating. And there's a lot of more, like that was the bad as it is, but that was just a small effect of what other people can get. When my father got it, he got double pneumonia and he's diabetic and he had to go to the hospital. Thought I was going to lose him, but he ended up being, God's will. He was okay, but he made it through. But, some people might think that, oh, it's really not anything, but it impacts you, it's going to be something. So, why wait for it to impact you? Just start following the procedures now. And that way you don't have to, because basically if you violate a regulation, you're gonna have to follow more regulations. So why inconvenience yourself and just do the one right thing, and that way you don't have to go through quarantine. You don't have to go through all of that other stuff, the isolation.
Right, watching everybody else have fun. Yeah.
Yeah, one thing I think about is school is probably and especially like a middle school or elementary school is probably the biggest like cultivation spot for this disease, just because you're dealing with younger kids who don't necessarily understand, why we're wearing the mask. They're told that they have to. So, with, 5, 6, 7, 8-year-olds, they're taking the mask off, they're running around, they're coughing all over each other, because that's just what kids that age do. But if you think about it, then they're going home to their parents, grandparents, whoever. Same thing for high school kids. We all are in this place together. I'm lucky to go to a high school that doesn't have a large population, which kind of benefited us in this, pandemic. There are, smaller class sizes. We don't have, a bunch of people just in one space. But even in our school, we have to take extra precautions to ensure that people aren't, the people who are around each other, we can track that just in case someone is to contract the virus, and we can, trace that, take care of it. But, just seeing how these larger high schools that have 1,500 plus students are sort of handling the virus, and they're saying, we got lower numbers now. We're going to, get rid of this mask mandate. We're going to allow everyone to, come to school unmasked. Like, it's just crazy to see you got 1,500 people in a building, sometimes they all in the same area, and you just allowing them to not be masked, although this virus is still very much, at its peak and peaking. So that's something that I just think about.
Yeah, definitely. And also, I just want to make a note, how you were saying, with the virus being at its peak, also with the different variants as well, the Omicron variant, they found that it was like, I think like 2 times more like transmissible. So it was even like, it was so much easier to get. And so, each time there's a variant, there's kind of something else that comes along with that, maybe it's more easily transmissible, or maybe it causes more severe illness. And so also, when you're wearing your mask and you're getting vaccinated, it slows the spread, of the virus and everything, which means that there's not as many variants that are being created, it's not mutating as much. So that's also why it's important, to follow, the COVID protocols in schools, if they're not too relaxed and are still requiring that you wear your mask and everything. But yeah, there's just so many aspects, like surrounding COVID and just really why it's important to do your part and wear your mask and get vaccinated and social distance when you can. But yeah, it's definitely really hard in schools where you have such a large volume of students in all area, because if there is an outbreak, if they do relax the protocols and say, okay, you don't have to wear your mask, and then it only takes one person to come to school infected, and then they, get everybody else sick, and then it's, the school has to be shut down. So it's just a domino effect. So yeah, I definitely agree with what you were saying, Everett.
All right. Any other questions before we head on to the next one? All right, I'm gonna take that as a no. So we already kind of discussed a lot of why we should do this, but specifically, why is it important to wear a mask regardless of vaccination? Now, I'm gonna go ahead and answer my own question. You can still get it, you can still spread it, and you can still potentially kill someone. All right, anyhow.
Mic drop.
Yeah,
Boom.
exactly. Literally, that's it. Yeah, even if you're vaccinated, the vaccine, a lot of people had some misunderstanding that like, oh, if I get the vaccine, that means I won't get COVID. No, if you get the vaccine, that just means that severely lowers your chance of getting, severely sick if you do get infected, and, decreases your risk of being hospitalized and getting, your loved ones or people that are immunocompromised, sick. So, even if you're vaccinated, it's still really important to still wear your mask, because actually, and they found that people who were vaccinated were more likely to be, asymptomatic. So you might not even know that you have it. So, but if you're wearing your mask, at least if you don't know you have it, you are protecting others from getting it. So yes, regardless of vaccination status, you should be wearing your mask, as much as possible.
Yeah, one kind of term that was like coined with this virus is like preventative measures. I think that's what the vaccine and a mask and social distancing is. It's a preventative measure. It's not a cure whatsoever. Wearing a mask is not going to stop you from getting or transmitting the virus, but it is to help prevent that. And I think a lot of people don't realize that, like we're saying, like some people will make jokes or be critical of the virus, saying, "Hey, what's the point of getting it if it's not going to cure me?" I don't think they understand that it's to prevent, the spread, to prevent you getting it. It's not going to be 100% effective. I'm not sure if there is a vaccine, and I could be wrong, that is 100%, you're not going to catch whatever disease. So I think that a lot of people need to stop being so critical about this. And obviously wearing your mask is important, because even like was already said, you can still get it, you can still spread it, you can still potentially, harm someone or even, kill someone. So it's important to, keep your mask on.
Yes, and
Oh, my bad, Jasmine. Go ahead.
I was just gonna briefly throw in, like, we talk about the vaccine and the masks, and we have to remember, like, these are layers of protection again. So if you got your vaccine, but for some reason the virus is like, nope, I'm still about to show out in this person's, immune system and be, highly transmissible and all that. Like, that mask is doing the work. You know what I'm saying? Like that inside, obviously, the vaccine is doing the work to make sure you're not in the hospital, but the mask is doing the work to make sure you're not giving it to, your auntie or your, cousin who might, end up in the hospital had they, contracted COVID. So again, we are layering protection here. And that's really, what you do with many type of infectious diseases, to make sure like it's not continuing to spread. And I will say, with the vaccine, like it does reduce the risk, so it doesn't completely eliminate the risk, but there's always that like between 0 and 100 as far as risk. So it's not just like, oh, it's the same if you get the vaccine or not. It does help. It just isn't perfect. So
A perfect comparison, just to kind of piggyback off what everyone was saying, is it's kind of like birth control. It's there, it's an option, it's a preventative measure, but there's still a risk of something happening. There's still a risk. But in this, there's having no taste or smell, having organ failure, brain damage, and just the list goes on and on. And I feel like it's important to wear your mask and get vaccinated, because that's why certain people, although we still recommend you, regardless of what your school or institution is saying as far as restrictions, we still encourage you to wear your mask if you're around other people. But the reason why people have kind of been a more lenient or lifting regulations is because people have been getting vaccinated. We have 65.9% of the US population has at least one dose of the vaccines, and that we're not at 70% yet, which is what we need to be at. I pretty much, and then we'll kind of be comfortable around there. I remember the Michigan American Public Health Association was discussing that, but it's just very important. It goes to show that they work. We've seen other countries, in Europe and in Asia, that handled the vaccine situation or the pandemic overall better, and they got right back into opening up the economy, opening up everything. And that's because they follow the procedures, and we can do that too. And we're close to it. We just need to keep it on, and then we'll be free. So. All right, I guess I'll kick it off with
Pause.
Oh, my bad.
Sorry.
Go ahead.
Well, I was actually going to pass it to you anyway, so go right ahead.
Okay. All right, everyone. So I'm gonna hit you guys up with the last two questions to conclude our dialogue. So you might have been asked, what are the side effects of the vaccine? So I wanted to ask you all, what are the potential side effects of the vaccine, and what's worse, the side effects of COVID, the vaccine, and just what are the side effects of the vaccine? So the floor is open.
Yeah, so I can talk about this a little bit. So yeah, so whenever you get any type of vaccine, your immune system is going to respond because that's what it's supposed to do. And anytime your immune system is responding, you're going to get inflammation. You're going to have side effects like a fever, headache. You might have body aches or chills, and that's completely normal. That means that your immune system is doing what it's supposed to do, and it's making the antibodies. And in the case where, if you have a cold or something, it's fighting off the infection. But in, the case where you get a vaccine, that's why you get those side effects. So sometimes people misunderstand that. And I've heard people say, oh, well, when I get the flu shot, I always get sick after. Or with the COVID vaccine, oh, well, I kind of got sick, but it's, you're not actually sick. You're just having some mild side effects because your immune system is doing its job. And me personally, when I got my COVID vaccine, I had body aches really, really bad. I had fever, but it wasn't anything that was like, I just took some Tylenol and I was fine. And I definitely think that I would much rather have to deal with that than actually getting infected with COVID and dealing with those long-term complications, because especially with the main one, one of the symptoms being, shortness of breath or cough, that is definitely not a fun feeling when you feel like you can't get in enough air. So I can't even imagine what the people who have been ventilated, who have, gotten COVID and ended up in the hospital. I can't imagine what they, went through. So I definitely would say that the benefits of getting the vaccine, outweigh the risk, and definitely is way better than actually getting infected with COVID.
Yeah, I agree. I was a similar situation. Before getting my vaccine, I had already had COVID. I was lucky to get a mild case of it. I think the worst I had was just like tiredness, and like a headache and a sore throat. Like that was just the stuff I was dealing with. I didn't really get any shortness of breath or anything, luckily. But upon receiving, the vaccine, and I've had both doses and been boosted, each time. Well, the first time I really didn't get any sort of side effects. I think it was just a little soreness, obviously, because I got a shot. But with the second dose and then the booster, it was just, the body aches, the chills, a headache, just the little stuff that, is much better than, like Alexis was saying, being on a ventilator or having to be on a breathing machine. Like I have a close friend whose mother had COVID really bad, and she had got pneumonia from COVID, and just watching her have to deal with that and have to be on a breathing machine, months after her actually contracting the disease was just like really hard to see. So it was just like, would I rather, get a, vaccine, be a little under the weather for a day because I pretty much recovered from the second dose in the booster, the next day, like I was back to normal. Or would I rather, have months of, issues dealing with, being on a breathing machine, short, like not being able to, walk around because I'm short of breath, not having an appetite, things like that. Like I would rather, deal with the 1 day sort of things, or even maybe 2 days, than, have a months or a lifetime of issues afterwards.
Yeah, exactly. And I forgot to mention about the time frame. Yeah, and the side effects after you get the vaccine, I think the longest, I think the average is about like 1 to 3 days for most people. But it can, last a little bit longer than that. But it's not going to be much longer than about 5 days. You're not going to still feel crappy after you get the vaccine with side effects. Usually after a couple of days, anything you do feel will subside. And like I said, I mean, if it really gets that bad, you can always take some over-the-counter Motrin or Tylenol or something like that to help with the with the side effects.
Absolutely. And thank you for those tips, Alexis. Is good for the people out there listening, considering taking the vaccine, what steps they should take to help, I guess, lessen or kind of help. How do I say this? Like you said, it's good to have that response, that immune response, but not make it as negative for the recipient. So thank you for that. Cole, Jasmine, anyone else have anything to add, or now I can take it to the next question?
Oh no, our doctor got it. Okay.
Okie doke. All right, the last question. We kind of already answered this a little bit, but if there's any other knowledge you'd like to help shine with us, that would be great. So last question, how do you think we can help eliminate this virus, and are we close to doing so? How close are we, and can we eliminate it?
I think we can definitely eliminate it. As far as how close, I can't really give like a definite answer on that. I feel like we are definitely doing better. Like you said, I believe you said like 65.9% of our U.S. population is vaccinated. So that's a huge feat. I didn't even know that, and I'm glad to hear that. So I think as that number continues to rise and awareness continues to spread, like the work that we're doing here, and there's lots of other people doing similar efforts. So I as long as we continue this, I feel like we should be, able to get over it and get through it. I hope that it's soon, because just like everybody else, I am so tired of this pandemic. But I definitely believe that it is like we can overcome it. And the timeline just depends on how quick we can get the rest of our community to join in with us.
Now I want to echo what Everett is saying. Like we have to do our part. And it's going to depend on, so like in Genesee County, 63% of our community members have had their first dose, and 52.5% are fully vaccinated with their second dose, not necessarily the booster. But we have within our local community, like we have quite a ways to go to make sure like transmission isn't, every other person in our community. So and of course, like I'm not God. I can't say, oh, on this day we're done. I do believe that there will be a day where we'll be like, remember when we were in the pandemic? Not but remember when we were in the pandemic, and look at where we are now. But I think I can't, say how close we are, because the word in pandemic means globe, it's global. So even if we can, eliminate transmission in the US, it might still be elsewhere and people travel. However, if we can get it under control in the US, that would really help the world out as we, try to get rid of this virus. And then another thing we can do, like to kind of help us get rid of it is, so, we all travel, like everybody's kind of going, living their best lives, especially in the summer. Like make sure, you're following your protocols at home, but also wherever you're traveling, like consider the people that live in that community, in that, country, especially if their country doesn't have as much access to the vaccine as we do here. Just like being mindful of, let's not do what, let's make sure we're just not bringing disease to to other communities. And then, of course, encouraging people to continue to like get tested. If you're going to throw a wedding or something like that, say, hey, in order to come to my wedding, you have to get tested, just to encourage people to, break that chain of transmission. And then, encouraging people to get vaccinated and doing the same.
Yeah, that's such a good point, Jasmine, because my birthday was February 24th when I turned 25, and I had a little gathering in my apartment, and that was actually one of the things that I did. My friends, I'm like, well, if you want to come over, you're gonna have to show me like a negative COVID test, like that you got within 24 hours. So definitely, like, you're gonna go to a big gathering or something. Definitely, try and have people get tested. And then even at the gathering, if it's possible, still try and wear your mask. I know sometimes it's hard depending on what the gathering is, but yeah, just, I think that if everybody is doing their part, and you have gotten vaccinated, you do wear your mask. Also, making sure you wash your hands. A lot of people, I've had someone say like, oh, well, COVID is airborne. So like, I usually don't really I don't really use hand sanitizer or wash my hands. And I'm like, okay, I understand it's more airborne, but I promise you, you still need to wash your hands with soap and water. So definitely, for at least 15 seconds, you can sing the ABC song, something, but definitely still washing your hands with soap and water, wearing your mask, avoiding crowds and test. If you do feel sick, make sure you get tested. I know a lot of people don't, they might feel like they might have symptoms and just attribute it to a cold. Oh, I know my body, I don't have COVID. But, you can't make that assumption, because so many people, when they get COVID, some people do have just mild symptoms like a cold, but some people get really sick. So you just don't know. And in this time, you just can't make the assumption that, oh, I have the flu, or oh, I have a cold. So, getting tested is also really important. If you don't think that you have COVID, definitely making sure to do that. I know the test is uncomfortable if any of you have had it done, but I promise it's worth it to know, if you're infected, because then, that, if you don't have to go around, your loved ones or get other people sick, you don't want to be doing that. So yeah, I think we covered most of the precautions and things we can do to keep protecting ourselves from COVID, so we can hurry up and get rid of this pandemic.
I know that's right. And just kind of to echo what everyone has said, to be honest with you, getting vaccinated is kind of like voting. It can easily sway outcomes of things, right? And when a lot of people start saying, oh, I'm not going to vote, or I'm not going to get vaccinated, think of the millions of other people that have the same train of thought. And then you got nobody, going out there. So just everyone out there contemplating, just take your time. We're not pressuring anybody. Still just do it for the safety, because it's the law and the rule, and it's ethical. But just consult with your doctor, a physician. If you have any family or friends in the medical field, students, or even just whatever we've discussed on this panel, hopefully can be of use to you. If you're unsure about it, do your research. And yeah, like I said, just getting vaccinated, count of how many other people are having the same train of thought, and then we're gonna boom, back to square one, knock on wood. But I guess lastly, kind of closing out, an analogy I'd like to give is like, think of it like you're in Indiana Jones or Temple Run, right? Like behind you is an obstacle, like a big rolling stone, a ball, right? And that's COVID. And if you just sit, and then you're at the cliff and there's a vine and there's the vaccine, and you're the person contemplating is unsure if that vine is safe, if it's stable on that branch. But if you sit there, you're going to get crushed by the stone behind you, and that's COVID. So basically, the point is, COVID is going to impact you. And whether you're symptomatic or asymptomatic, it's going to affect you. Like Alexis was elaborating earlier, how some people had no symptoms, but were still it was a silent killer, right? But if you take that branch, you might be thinking, what could happen? But you're still the higher percentage of you living and not getting injured than just sitting there getting crushed. So, and I seen Jasmine just add in the chat, get vaccinated and keep getting vaccinated and boosted. Don't let the virus out mutate us. I know that's right, because it has more upgrades than my Horizon plan. And shoot, Cole, let me see what he said real quick. He said, for a virus turned into a political problem, 63% isn't so bad. And that can just inspire you as well. We've seen a lot of kind of hypocritical statements. People originally telling you not to take the vaccine ended up taking the vaccine. So yeah, and it shouldn't be a political issue because this is a life issue. So, all right, does anyone else have any other comments or knowledge to drop on us? Okie doke. Well, thank you to my guests and thank you to my co-hosts for taking the time out of your day to help us with this project with the Michigan American Public Health Association. This is the Flint Public Health Academy Hub. I'm Tomás Teo, and have a good evening. Thank you, everyone. Stay safe.
Good night.